Hi, I'm Dr. Rosenberger from Appalachian Spring Dermatology, and today we're going to look at injecting the platysmal muscles in the neck with Botox, and we'll talk a little bit about that. If you think my face looks a little red and blotchy, that's because my previous video was doing a touch-up on Botox on my face, so you didn't see that one, you might want to go back and look at that one. But today we're focusing on the neck. So if you've watched any of my other videos where I look at talk about Kybella, I talk about how, you know, I'm a little obsessed about having a double chin, so that's probably since childhood when they told me to hold my face a different way in pictures so I didn't have a double chin. So I've gotten rid of actually most of the fat in my chin. There's a tiny little bit left there. But still, a lot of times in pictures, and even when I'm talking now, you can see my neck is really, my jawline is really drawn down. And that's not actually because of fat, it's actually because of muscles. So there is a muscle in your neck that drapes on the whole front and side of your neck called the platysmus. And so I'll exercise that for you here today so you can see it sticking out. Okay, so I also exercise a lot, and so when you do a lot, sometimes people do that when they do sit-ups or when they're straining. So if you're an athlete, try not to do that unless you want to have strong platysmal muscles someday. I also was encouraged in my youth to do some chin exercises like this to help reduce the fact that I had a double chin. But guess what that did? That strengthened my platysmal muscles and gave me more of a double chin. So don't do platysmal exercises or any kind of chin exercises or you'll end up like me. So nonetheless, I'm going to demonstrate some of these muscles. I've already put some marks just because it'll make it easier for me when I'm doing the Botox, but just demonstrate how sometimes I'm asking patients to make a face so I can see their muscles a little bit more, and sometimes they're a little bit confused. So first of all, you sort of grit your teeth down. Okay, so you can see these muscles here, these bellies of these muscles, okay? And sometimes I can, well, you can really see this one here, right? So it's certain yucky faces, but it lets you see the muscles pretty well. The problem is when I smile, look at that. If I smile really big, I got all these muscles jotting out all over the place, and so it doesn't make my profile look so great. So I actually haven't done anything on my neck for quite a few months, just out of laziness and wearing a mask. So we're gonna get this fixed up today, okay? So again, I have 2 injection points here on this one and 2 here on this one. And these out here aren't quite so heavy. Actually, I didn't put a mark on this one. These 2 aren't quite so heavy, so I don't need quite so much in there. So the bigger, the thicker the band, in essence, the more Botox it's going to take. All in all, so I actually put, when I did just to give you reference, when I did my face, I put 6 units on each side of my eyes and 2 units on each side of my nose. And then in my neck, I'm going to put 4, 2, 4, 2, 2, 2, 2. Okay, so, and that may or may not be enough. It's been a while since I've done it, so I might need to update that. On patients, sometimes the first time I'm really gentle. If you overdo the platysmal muscles, people don't realize how much they use these muscles, and sometimes it feels like their neck feels almost like weak or something, or I don't know how else to explain it, almost like almost a little bit crampy because they're trying to use it and they can't use it. So it takes a little bit to get used to, but it's worth it. I'm wiping my dots off as we talk. All right, so anyway, I can see them really well. Anyway, here we go. I always wipe a lot with Botox, with alcohol when I do Botox. One of the things that freaks me out is when I see people doing like a Facebook Live or something. This is sort of tough right there. And they do not wipe their patients off with alcohol, and I'm thinking, dearie me, they're dirty. You need to clean them off. So I use a little bit of about alcohol, just because of COVID. I've always done that. And knock on wood, I have never ever had a patient get infected from me doing Botox. But that's probably because I wipe them before I stick the needle in, and I wipe them after I stick the needle in. Alright, I'm going to use this. See, this one's not quite so prominent. I'm just going to grab it down here. So what I usually do, the other thing is, particularly when you're looking at the front of the neck, you know, there's some important things in here you don't want to get Botox in. So you'll notice that I sort of exercise the muscle, pick it up, and then so that I have the muscle and the skin way, way, way above all the important things that are underneath. This is not something, in my opinion, that you should have done at a spa. It requires, oh, sometimes a little bit hard to do yourself in the mirror. It requires a little bit extra skill. So once at the American Academy of Dermatology meeting, they did this in what they considered the advanced Botox class. So it's not for your casual person, because again, there's some important things here in the neck, and we want to keep the Botox where it belongs only. So hopefully my next set of videos at some point in time, maybe I can show you the lack of these muscles doing this, and maybe even just do a before and after picture. I'm honestly not very good at doing the before and after stuff, because that's just how it goes in life. All right, so today, if you didn't see the previous video, we did a little touch up on the face. We're gonna get these platysmal muscles under control, and hopefully that helps. I didn't mention, but in this today, have been using Jeuveau. There are 3 botulinum toxins that we use interchangeably here in the office, and they would be Xeomin, Botox, and Jeuveau. I don't know if you can see that. They might be backwards, but nonetheless, we use them interchangeably. I had a lot of Jeuveau, so I used Jeuveau today. So we're always here to help you if you need some Botox, and you know, there is a lot more focus on the upper face now and the neck, because this part of the face, lips, people are really into having their lips look good, but you know, lots of places that's covered now. So now we're looking here and here. So have a great day.
Call for an appointment today and learn more by going to our website at wvderm.com.